Hoarding occurs when someone struggles to discard items and collects unnecessary objects over time. The inability to throw things away can overrun the pace of collecting. The ongoing buildup of collected items can lead to unsafe and unhealthy living spaces. It can also cause tension in personal relationships and severely diminish the quality of daily life. Hoarding disorder is the condition associated with hoarding. Hoarding disorder can become worse with time. It most often affects adults, though teenagers may show hoarding tendencies as well. Hoarding disorder is classified as a disorder in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. This designation makes hoarding disorder an independent mental health diagnosis. Hoarding disorder can occur simultaneously with other mental health conditions as well. Treatment requires self-motivation and the desire to change one's behavior. It also requires the involvement of a doctor. Family support can be helpful as long as it's constructive and not accusatory. Now you might be asking, what causes hoarding disorder? Hoarding disorder can occur for several reasons. A person may begin to hoard because they believe an item they've collected or are considering collecting may be valuable or useful at some point in time. They may also connect the item with a person or significant event that they don't want to forget. Hoarders often live with their collected items at the expense of their own needs. For example, they may forego using their refrigerator because their kitchen space has become blocked with items. Or they may choose to live with a broken appliance or without heat rather than let someone into their home to repair the problem. People who may be more vulnerable to hoarding include those who live alone, grew up in a disorganized space, had a difficult, deprived childhood. Hoarding disorder is also associated with other mental health conditions. Some of these include anxiety, ADHD, depression, dementia, obsessive-compulsive disorder, obsessive-compulsive personality disorder, schizophrenia. Hoarding disorder isn't uncommon. Approximately 2 to 6% of people have hoarding disorder. At least 1 to 50, possibly even 1 to 20 people have significant or impulsive hoarding tendencies. Hoarding disorder affects men and women equally. There is no research-based evidence that culture or race or ethnicity plays a part in who develops the condition. Age is a significant factor for hoarding disorder. Adults aged 55 and older are 3 times more likely to develop hoarding disorder than younger adults. The average age for a person seeking help for hoarding disorder is around 50. Adolescents can also have hoarding disorder. In this age group, it's generally milder and symptoms are less distressing. This is because young people tend to live with parents or roommates who can help manage hoarding behaviors. Hoarding disorder can begin interfering with daily activities around age 20, but may not become severely problematic until age 30 or later. Hoarding disorders build gradually over time, and a person may not be aware that they are exhibiting symptoms of hoarding disorders. These symptoms and signs include being unable to part with items, including both valuable and invaluable objects, having an excessive amount of clutter in the home, office, or another space, being unable to find important items amid excessive clutter, being unable to let items go for fear that they will be needed someday, holding on to an excessive number of items because they are reminders of a person or a life event, stockpiling free items or other unnecessary items, feeling distressed but helpless about the amount of stuff in their space, blaming excessive clutter on their space's size or lack of organization, losing rooms to clutter, making them unable to function for their intended purposes, avoiding hosting people in the space because of shame or embarrassment, Putting off home repairs because of clutter and not wanting to let a person into their home to fix whatever is broken. Having conflict with family because of excessive clutter. Diagnosis and treatment of hoarding disorder is possible. However, it may be difficult to pursue a person with a hoarding disorder to recognize the condition. Families or outsiders may recognize signs and symptoms of hoarding disorder long before the person with the conditions comes to terms with it. Treatment for hoarding disorder must focus on the individual and not solely on the spaces that have become overrun with clutter. A person must first be receptive to treatment options in order to change their hoarding behavior. Someone seeking treatment for hoarding disorder should first see their doctor. A doctor can evaluate hoarding disorder through interviews with the person as well as their families. They may also visit the person's space to determine the severity and risk of the situation. A thorough medical evaluation may also help diagnose any other underlying mental health conditions. Individual group cognitive behavioral therapy may be the most successful way to treat hoarding disorder. This should be directed by a medical professional. Research has shown that this type of treatment can be useful. A review of literature indicated that younger women who went to several cognitive behavioral therapy sessions and received several home visits had the most success with this line of treatment. Cognitive behavioral therapy can be done in an individual or group setting. The therapy focuses on why someone may have a hard time discarding items and why they desire to bring more items into a space. The goal of cognitive behavioral therapy is to alter behavior and the thought process that contribute to hoarding. Cognitive behavioral therapy sessions may include creating decluttering strategies as well as discussing ways to prevent bringing in new items to the space. No medications exist specifically to treat hoarding disorder. If you enjoyed this video, subscribe, like, share, and comment.